I have a strong belief, and I'm gonna get on my soapbox here, Eric, is that the industry has gamified health so much that we've actually disconnected people from their body. We're the only company that's building it for you. We get your permission to access your data on your behalf for your benefit.
I'm trying to figure out how do we make these connected dots, but again, in a very thoughtful, ethical, and profound way.
What we did at LifeLock is we aggregated disparate financial data, laid intelligence on top of it around your financial behaviors, and sold it directly to consumers in a regulated space.
Welcome back to the Future Human Experience podcast. I am your host, Eric Rodriguez, and today we have a very special guest, the co-founder of Wellbeing, Greg Lim. Welcome to the Future Human Experience.
Oh, thank you for having me. I'm really excited to be here.
Well, Greg, we had an opportunity to meet not too long ago because of the work that we get to do in Valley Leadership, but most of our conversation today is going to be about Wellbeing, a very innovative platform, very innovative service that you've been working on for some time. Can you share with us a little bit more about what this company is and the problem that it's thriving to solve?
Yeah, absolutely. First, let me share why I'm doing this, because I think that really matters. I wouldn't say I'd use the words fortunate at the time, but in retrospect, fortunate to turn them into learning experiences. Both my mother and father have had various health issues in the past. My mother had a long journey with autoimmune disease. She had multiple doctors, repeat tests. She used to carry a file folder with all of her all of her paper records from doctor to doctor, because no one was seeing what was going on. Her neurologist was only looking at her brain, her endocrinologist was only looking at her blood markers, and no one was looking at her as a complete person. And they really missed this diagnosis for multiple years. Good news now, she's much better, babysits my kids twice a week, so she's doing great. And then most recently, my father had a second stroke, was admitted to a hospital. He was discharged while he was still stroking out. And I really learned a few things through both of those experiences. The first thing is your doctors, and God bless all these amazing healthcare professionals that I've met. Everyone's doing their best job in these difficult scenarios. But what I've really learned is healthcare professionals only get to know you for those 7 minutes you're in the office and that one test that you took. So we're completely ignoring the other 364 days when you're not at the doctor's office. But that's your life. That's most of your health. And so that was the first thing I learned. The second thing I learned is that lots of doctors don't talk to each other. I assumed when I went to my doctor, he or she is opening her laptop, they have all of my medical records. That's actually not a thing. Your doctor only has your medical records from your visits to him or her, or maybe the hospital system if they're one of the more advanced ones. And so everyone's trying to do their best, but they're only seeing part of the picture. And so to your original question, what we've built for Wellbeings, it's really, it's a love note to my parents and their experiences. We're building a universal health record. We're able to get your medical records across different doctor groups, hospital systems, and EHRs, your prescriptions across the different pharmacies, layer in your lab results, as well as your real-time data from any wearable. So for the first time ever as a consumer, or just as an individual, you can actually, one, own and access your own health records, and two, we have an AI, health-trained AI on top of it that turns that data into proactive health information so you can effectively manage your health. And so it's been a journey with my mom, with my dad, now having between both of them gone to hundreds and hundreds of doctor's appointments as their primary or secondary caregiver. It just made me realize that there's something missing and it had to be solved. And it's been a long journey because it's a hard problem. That's the reason no one's done it. But I just think it's so important for the patients and for their loved ones supporting them.
But also, Greg, I mean, it could be this is also the perfect timing of this, right? I mean, we're inundated in this era of not only AI, but data that we're saying we can measure everything, right? And the service that you're trying to bring to the table is, okay, how, with all this noise that we have around health, how do we create, or how do we tap into the signals in this space with all, like you were saying, I mean, wearables were not a thing 10, 15 years ago. Now they're still not abundant, but they're becoming much more accessible. Same thing with digital information now that we have with our doctors. Most of my appointments today, when I'm either signing in or getting my lab results, I would say in the last 5 to 7 years, they've become much more digital. Before it was like, I would get it in the mail or I would get a phone call with the results. Now I have a digital record, but you're right, they're kind of isolated.
Yes.
And what you're trying to do in this era of connectivity, we're trying to figure out how do we make these connected dots, but again, in a very thoughtful, ethical, and profound way, right? Because another piece that I would ask following up to this is, we've also considered healthcare. One of the barriers of healthcare has also always been privacy too, how we navigate the privacy aspect of things. How have y'all been navigating that aspect of privacy, right? Because we could also go to the extremes of that too and saying, well, I need to isolate this. Greg is the only one that is authorized to see this information. No one else, and unless he says so, no one else could see it. Yes. How have y'all been navigating some of those aspects in our history with how we deal with privacy in this digital era?
Well, I think there are a couple of things you mentioned there. I think it was really insightful. We don't have a data issue. We have more data than we've ever had, but it's not anywhere that's usable. It's in 37 different places across 18 different systems. And what we're really doing is just trying to simplify it. How do we bring that all together in one place that's accessible and understandable by you? We also knew that this was our North Star. And so by doing this, we knew that we had to deal with HIPAA. We knew we had to deal with privacy. We knew we had to deal with security. One thing that makes Wellbeing truly unique is, I'll be honest, there are other people trying to do this, but they're trying to build it for your insurance company. They're trying to build it for the medical system. They're trying to build it for the doctor. We're the only company that's building it for you. We get your permission to access your data on your behalf for your benefit. And that's really important. So it's your data. You want to share it with someone? Great. You want to recall it? Let's take it back. You want to say, I'm out of here? One button delete out of our system. This isn't about us owning your data. It's about us helping facilitate you access to your own data and own data ownership. I mean, the parallel I use, imagine if I were to go to you and say, Eric, I'm going to take away access to all of your bank accounts, all of your credit cards, but I want you to make really sound financial decisions. You'd be like, that's crazy. But that's exactly what we've normalized in healthcare. Every other aspect of our lives, we own and access our own data, except where it matters most, our most intimate, personal, and important information for making good health decisions.
Interesting. And Greg, I mean, you bring up a great point right now that intersects with my family story too. When we first met, you were sharing your powerful story of your family, and my dad was just going through what he was going through at that time, and he's doing much better now. But I was really surprised on how much the insurance system dictates our access to certain health care, basically, essentially, right? And I remember having this conversation with one of his doctors and asking, okay, well, what is the next best step for my father? And they said, well, we have to wait until the insurance tells us what it is. I'm like, no, you're not asking, you're not understanding my question. I'm asking, what is the most important health decision we need to make for our father right now? And then his answer again was like, well, it depends on what the insurance says. And I kept going back. I was like, that's a bureaucratic decision. I'm just asking you from a healthcare provider perspective, your professional opinion on what my father needs for his next step. Forget about the money, forget about the approvals or whatever. And he struggled with the answer. Right? Again, they're trying to do their best, but it seems that also that we've been trained so much, right? We've been numb that, hey, we have a process to access these decisions, and therefore that is the best system that we have. And what you're trying to do is you're trying to unlock that, at least open it up so those decision makers, those healthcare providers, those individuals that are navigating the day-to-day of this, we can make much more thoughtful decisions versus just, well, let's just wait until what our system tells us we need to do.
Exactly. And, I have a lot of sympathy having gone through the journey myself as a patient and a caregiver, but also for the health practitioners, because they're not happy. They realize that this difficult situation they're in. I've learned a few things kind of over this journey over the last year is when I talk to people, almost to a person, I'll be having a conversation, and about halfway through, their body language shifts. I see it. They take a sigh, their shoulders drop, there's a sense of relief. And because I've shared my story, they feel comfortable sharing theirs. And they say, well, my wife is going through this. My child went through this. I'm caring for aging parents. And to a person, almost everyone I've spoken to has a medical story or an insurance story related to medicine. And so clearly whatever we're doing isn't working on the patient side. And then when I talk to these doctors, they're actually really excited. I thought doctors would be a little bit reserved about us coming in and giving them information. We're not trying to do their job. We truly want to support them. But I thought there might be a bit of a hesitancy in what doctors, again, to a person have told us, said, if you can come in and the patient can come in with a clear understanding of what they want to talk about, what's going on in their body, help me more rapidly understand what's going on and get to a diagnosis. What they're most excited about is not only being able to help that patient more effectively, but actually freeing up the rest of that 7, 10, 13 minutes that they barely get to actually be human and connect with their patients. because it is insurance driven and they spend 7 of 10 minutes just trying to get data out of you. Then they have to make a diagnosis and they don't even get to ask you, Eric, how are you doing? How's your family? Oh, how's your dad? Is he doing better now? And that human connection and that passion that drew them to medicine is just missing in the system. And so somewhere in this, we're not going to magically solve it all ourselves, but I think we can be a enabling layer.
Absolutely.
Where we can help patients, we can help families, but we can also help the caregivers and the doctors and the systems because it's not working on either side right now.
Yeah, and I think what you're sharing with us too is that the systems that we have in place right now and how we've innovated in certain industries, they're the best that they could be at this point in time. It doesn't mean they are fantastic, they're great, but they're the best that can be. Sometimes we just get complacent with that. And I think as we're building this more human-centered era, what you are challenging all of us to do is to have a much more of a human experience when it comes to our healthcare. It reminds me of this 2 conversations I've had around this, right? It was one, we live in the Phoenix area, so we have Waymos all around us. We probably already had 5 Waymos go on our background over the last few minutes. And they're like these self-driving cars, all data-driven. And so some of the conversations people have with me is like, well, Eric, then, the Ubers are going to go away. And I was like, no. The Ubers are staying. The best Ubers are going to be the ones that stay. The more thoughtful, human-centered, you feel like you're walking into a limousine Uber are the ones that are going to exist. Same thing with the banking service. Like you were just asking us, well, what happens if I take all your banking information away? Well, what happens if the opposite happens? What if I give a certain sector of the banking industry all my data, all my information? How would they serve me? They'll serve me very differently. I walk into the bank and they'll be like, how are you doing, Mr. Rodriguez? How's your retirement doing? How is this going? How are your children's plans going? Like they'll have all this access to this information versus spending 7 minutes on just getting to know me. They already know me. So their service will be different. So why can we not do that the same way in other industries as well? And that is what you're asking us all to do, that now the premium experience for healthcare should be much more human-centered.
Yeah. And it's 1, you can own and access your own health information between care. 2, your doctor and that interaction with the doctor is better.
Correct.
But now they're not separate, they're connected. To me, that's really what it's about. It's about a continuum, right? It doesn't matter. Doctors and insurance companies look at it, they call it point of care, when you're in the office having a conversation with the doctor. As a patient or as a consumer or as just a human, I think there's probably a better language to use. As a human, I don't care whether I'm in the doctor's office, I don't care if I'm relaxing on my couch, playing with my kids, I'm at my gym, it's just my life, right? We shouldn't have to segment those pieces, but really it's just a continuum of life, and how do we connect those dots to create a full journey? That's the piece that gets me really excited.
And Greg, this is not one of your first startups that you've been integrated with. You've been in this space of building businesses. What are some of those lessons that you've learned on that journey that you're bringing in today to Wellbeings to build something that's new and innovative and is going to move the industry forward?
Well, I guess first off, I'm a glutton for punishment. So I keep coming back to startups. It's interesting when you look back, I really believe that things happen for a reason. I spent 7 years at LifeLock, helping take that company public, prep it for a large exit. I ran the finance organization, operations, marketing, almost everything within that company. And what we did at LifeLock is we aggregated disparate financial data, laid intelligence on top of it around your financial behaviors, and sold it directly to consumers in a regulated space. Interestingly enough, what we're doing here is we're aggregating siloed medical data, layering on intelligence around your health, and selling it direct to the consumer and giving them access to their own health data in a regulated space. And so I'm really fortunate that there are so many direct correlations that I had at LifeLock, and then be able to kind of bring that into an area that I'm super passionate about, crosses over my professional background, and then obviously the passion of health, given my parents' story.
And Greg, when solving this medical or transforming this industry through a data-centered layer and security layer, are there other countries that have been trying to do this as well, or some have done it a little bit better than others that we could also learn from?
Yeah, it's a real mix. There are more than 5, less than 10 countries that have unified health records. That being said, it's usually just on the medical side. So again, you see a doctor 4 times a year, 15 minutes. What about the other 364 days and 23 hours? So I think there are a handful of companies that have done it reasonably well on the medical side. You get some countries like the UK. My understanding of their system is they do a good job with a national record, but it's only for the national hospitals. If you're a private hospital, it's not included. So there are a number of different hybrid models throughout. No one's actually solved what I would call a holistic health profile. There's both your medical and your real-time data all in one spot. and especially not something that's actually ultimately owned by the consumer.
Yeah. But even when we talk about our timing of this, and also doing it here in the United States, we are just primed for something like this, right? To explore this idea, because we've been normalizing ourselves using an Oura ring or a watch,
Yes.
right? It's like or a Whoop, right? These day-to-day healthcare, like there is a demand, or at least a curiosity of understanding, okay, what does my day-to-day health mean to me, and how can I make better decisions from that? With that said, though, also, Greg, how do we navigate in this era of constant data? How can we make better decisions with more data? How have y'all been navigating that?
That's a great question. More data isn't always a good thing, right? It can become more overwhelmed. I see these trends in the biohacking space.
Yeah.
Oh, am I meant to cold plunge? Am I meant to do hot sauna? Am I meant to do infrared therapy? Am I meant to take 5, 10, 15, 20 grams of creatine? And people get so anxious about their health, even though they're trying to make the right decisions. And so part of our job is the foundation is the aggregation of your data into what we call a living health profile. So one, it's your data. You deserve the right to own and access it. But that doesn't mean you're qualified or can take the time or have the resources to understand what that means. So the second piece of what we're doing at Wellbeings is layering on a health-trained AI that's private, personalized, and proactive, that turns all of that data into actionable health information. I have a counter approach to what I see happening in the industry. I have a strong belief, and I'm going to get on my soapbox here, Eric, is that the industry has gamified health so much that we've actually disconnected people from their body. So I wear my Oura ring, I wear my watch. God, my sleep score went up. That's great, but I still feel tired. But my watch knows better than I do. And so then it's like, well, do I trust it? Do I not? Do I start ignoring it? Or the other thing is like, well, great, my sleep score went up. But why did it go up? What's going on in my body? What can I repeat to actually get better? And we've gamified everything and simplified everything to a score. And I understand why, right? That's not a knock. We've got people adopting it. We've got people aware of their health. That's the first step. But we're almost going down this path that is disconnecting people from actually understanding their body. So we've been very thoughtful at Wellbeings to create a communication framework, which is just 3 simple steps. What we see. Hey, Eric, over the last 5 days, there's been a trend. Your deep sleep is compressed and gone down. Your heart rate variability has actually decreased as well. That's usually a sign of your body shifting into fight or flight mode. Here's why we're seeing it, because of the underlying things that are happening in your activity, your sleep, your work. And then the third thing is, here are 2 things that you can do about it. So it's what we're seeing. Let's make a factual statement. 2, tell you why we're seeing it to re-educate you, reconnect with your body, and then give you a couple of options that are really simple, not overwhelm, but we're also giving you a decision. We're not telling you to do something. We're giving you options that work for you. And so just being really thoughtful about that communication structure to take what some of these other amazing devices and apps have done, but really move that to that next level.
So Greg, I mean, that is actually disconnecting our bodies from with our tech. I mean, that's one of the most thoughtful things I think I've heard about how we've been using technology. You're right. We've been gamifying this system. I had the Whoop for several years until COVID. My wife today has the Oura, and literally it's like, that's the first thing we do in the morning. She does in the morning. She checks it, and that drives the decisions we're going to make for the next few hours, right?
Yes.
But you're right. We need to be much more thoughtful. It's a great starting point, but we could do so much more. With that said, though, Greg, what has you excited about the future? I mean, you started this company in the last few years. AI is now becoming much more relevant in our communities. Connectivity is starting to become something. Digitalization, digital futures. We're now closer to 2050 than we are to the 2000s.
That's incredible,
right? What gets you? And you're a parent now as well. What has you excited about what the possibilities of the future could be, and where does Wellbeings fit into that promising, optimistic future that you're seeing?
I run an AI company. AI really excites me. I'll be honest, it also scares me a little bit. I think we have to be very AI is a tool. It's like any tool. How do we use it thoughtfully? And especially as a parent, how do I expose my children to AI? How do I empower them with AI? But also from a foundation that they learn how to think and reason for themselves. So maybe it's not your question of what's the future of AI look like and the hope, but on a daily basis, I really struggle with that balance. I know I'm old. I type prompts into my AI. My daughter just hits talk and speaks to it. I was like, oh, I'm feeling old all of a sudden. I want her to know how to use these tools, but at the same time, I don't want them to do the reasoning for her. And so that's just, I think we're at this really interesting inflection point where we haven't figured out what it is. And then you layer on the pace of change that's happening so quickly around AI. I just think that we need smart people like yourself having these discussions, because I think a lot of things are going to shift very rapidly here in the next 5, 10, 15 years. And we really want to be thoughtful and intentional about it so that we have the best outcomes as a society, or just as an individual, as a parent.
And what has always impressed me about your work and so many folks that we've had on this podcast that are building businesses is exactly what you're saying. They're thoughtful in their approach. They're not rapidly trying to reach the headline. They're not rapidly trying to say, okay, wait, why are we behind in this? They're like, hey, let's be thoughtful about how we're bringing this in to the market, into our industry, into our customers. So with that though, Greg, I mean, today people are listening to you. What is the organization looking for next? Are you looking for partners, customers, folks to work with, investors, or a little bit of everything? What would be a call to action if someone's listening to this and saying, oh, how can I get involved with Wellbeings?
Yeah, all of the above, right? We're a startup. We're looking for capital partners. Okay. We're looking for distribution partners, people to help us grow and prove out this model. And we're looking for individuals who just really want to own their health. So if you're an individual, please go to www.wellbeingshealth.ai. Or else reach out directly to me. Just email me at greg@wellbeingshealth.ai. Love to hear from you. Awesome. This is something I'm deeply passionate about. Love to engage people and just continue to learn and get smarter every day.
That is cool. And we'll have links to all that in our show notes so people can keep following up with you and the journey of Wellbeings. Greg, it's been a pleasure to have you on this pod. One thing that we love to do with our guests is we ask them to come up with a surprise question for me about either my work or my journey or what have you, whatever you have in mind. So Greg Lim, what do you have for me today?
You're such a futurist and technologist. I'd love to hear about the human side. One of the things I see is people right now, because of technology, we always thought it would connect us, but it's really disconnecting people. And I feel like everyone's craving community. What gets you most excited about the kind of the human side? Like, how do we build community, whether technology driven or not? Because I feel like that's, whoever solves that is going to be really help move community forward right now. Yeah,
that's a great question. I think as we're building a much more digital future, I do think the premium experience is a much more human experience. And even though there's a level of excitement entering the 2020s that we've all gone digital and we're all, remote offices, which is all cool in certain industries, it was probably 18 months later that we're like, how do we get back? How do we get back? Right? Because you're right. There's this craving to go back into
things we never thought we'd say.
Right? Like there was literally folks in the industry talking about like, we're in our 2030s now. This is exactly what we had planned. It's going to be awesome. And now we're still in our 2020s and we're craving this. And part of the reason why we have this podcast in person was because of that, right? I've had some guests say, Eric, I could do it on Zoom. I'm like, look, you know what? Either we do it here in Phoenix or I come to you, right? We always want to do it in person. So part of it is being much more thoughtful about creating those human experiences. And I think the second piece is understanding what are those digital things that will just get automated that now creates the premium experience, which is the human experience. And I think we're seeing that in multiple industries. I just shared with you an example, for example, with Uber in our banking sector as well, so some transportation and banking. I think you're trying to solve that in healthcare, right? I would say even our healthcare industry today, just like you were sharing, is not that human-centered, right? Because I just see them for 7 minutes. I answer the same questions every 6 months I see them, right? Versus a much more thoughtful experience, which I think we can have, right? But I think it starts with those thoughtful solutions that we could come up with, understanding what could be automated, what could be digitized, and embracing that, not just for the sake of embracing it, but understanding what does that mean for the human experience. And if we understand that the premium experience is the most valuable experience, which is the human one, I think you're going to build so many businesses and communities that are going to be much more human-centered in the future. And those are going to be the most valuable moving forward.
I love that. Thank you.
Well, Greg Lim, again, thank you so much for being part of the Future Human Experience podcast. We'll have the links to the business, to your email, just to continue to watch the journey and be part of it. But thank you for not only sharing your story, but being part of building a much more human-centered future.
I appreciate you. Thank you.
Okay. Thank you for listening to this episode. I'm inspired to hear that these conversations are resonating within our communities, our organizations, our companies, and our households all around the world. If you found this conversation to be valuable, please take the time to like, subscribe, and share it with someone else. I do believe that as the future gets much more digitized, it gives us an opportunity to be much more human as well. And these conversations are part of that journey. So if you're enjoying the content on this channel, please check out these videos. Thank you.